Let's talk about this pandemic and how it's affecting Nigeria. In the studio now on strategies to flattening the curve is Dr. Oyewole Folusho, Medical Officer of Health, Ikosi Sherry in Lagos State. Thank you for joining us at this time.
Thank you,
All right, tell us about your area and how you're managing some of the cases you're seeing.
Okay, thank you very much. I work at Ikosi Sherry LCDA, which is under Koshofe local government. Presently, what we are doing is we are doing active case search in which we go into the facility, both private and public. We look at their record to see as many people in the last 1 month who had come down with history of fever, cough, difficulty breathing, and sore throat. Then from there, we follow them up. Also in the community, we have some people called community volunteers who go from door to door to ask some questions about history of cough, breathlessness, shortness of breath, difficulty in breathing, sore throat, and if there is anybody that is sick or has died from any related cause or a cause unknown on COVID. And from there, we take them up. If there is any need for them to be tested, their samples will be collected, and from there we monitor and then we take care of them.
So now let's look at the issue of testing. The NCDC DG had made tweets and several comments as to the RNA kit, saying it's a critical component to identify and test for the virus and how we're in short of it.
Yes, like the RNA kit is a kit test kit. It's a kit that is used to detect the presence of the virus in anybody's body. But due to the present awareness of people, a lot of people even are subjecting themselves even to the test now. So it makes the kit to be scarce. And then there is another one, antibody test kit, which is going to detect the presence of the virus in who have been cured and those even who are not showing symptoms concerning the diseases, but they have it within them.
In terms of supply, where you're working, is there enough?
Well, we don't have enough. The reason is that a lot of people are now coming up for the test. So, and day by day, the Lagos State government with the federal and then CDC also are making sure how to get more and more to be imported into Nigeria and into the state so as to ensure a lot of people will be well covered at this period.
So if you have someone coming up with some of the symptoms now of COVID-19 and goes to the hospital or goes to one of these collection centers, what do you tell them if you don't have enough kits?
What we do is we collect their samples. As there are a few that we have on ground, we collect their samples and we take them to the test center. But there are other people who come, and if this test kits are not available, we give them another appointment, maybe a day or a few hours appointment. They will come back, we will reschedule them, and they will come for the test.
But is there also any way you monitor, because if you're still saying you're giving them an appointment, do you monitor that they self-isolate? How do you monitor and ensure that they're keeping to the social distancing?
Okay. There are two teams that work daily in each local government. We have the mobile team. If there is anyone that is showing symptoms, the mobile team will quickly go to them to take the sample. So those mobile teams are not exhausting their kit. They have more than enough. But those that are at designated points, they can exhaust their kit, but we will make sure if they are showing symptoms, we quickly isolate them in their place of residence, and we will now send the mobile team to them to go and take their samples.
So while the government thinks of ways of ramping up testing, Lagos is experiencing a larger number. Are you facing people who perhaps are not coming or are not willing to come out, for this test?
Yes, there are some people, despite the campaign and even the updates day by day, some people are not yet willing, but quite a few are willing to take the test. There are some toast line all around. People call every one of us day by day to book an appointment. And even now, the awareness is on the increase. Anybody that is having cough, fever, even breathlessness, without hesitating, they call themselves that, please, we want to come and have this test done. How can you be of help? And immediately, we ask where they are living, and we would now direct them to the designated testing site that is close to them.
All right, one moment. Let's quickly go on a short break. More on the COVID-19 pandemic updates when we return. And we continue with our guest here in the studio, Dr. Folusho, Medical Officer of Health here in Lagos State. Expatiates a bit more on the number of tests that we have, the number of test kits, the antibody testing, the RNA test kits, and what some are calling the home test kits.
Thank you very much. The RNA test kits, they are to detect the presence of the virus in the body. And also, it will help them also to discover or detect the antibodies against the virus. If there is anyone who had suffered from the virus with the antibody test kit, also it will enable them to be able to detect the virus in the body. And also, those people, there are some people now that they do what they call home test kits. Scientifically, it's not proven. Some people just gather and they think if we can do this at home to test if we have the virus, then we'll be able to know or not. So, but scientifically, it's not proven, so we can't accept that.
All right. We appreciate your time, Dr. Yewale Folusho, Medical Officer of Health. Thank you for joining us on the program.
Thank you.